Comprehensive overview of human metapneumovirus, HMPV. Introduction. Human metapneumovirus, HMPV, is a clinically significant pathogen that primarily affects the lower respiratory tract, causing a broad spectrum of illnesses, ranging from mild upper respiratory infections to severe complications requiring hospitalization. Identified in 2001, HMPV belongs to the Paramyxoviridae family and shares phylogenetic and pathogenic similarities with Respiratory Syncytial Virus, RSV. The virus contributes significantly to the global burden of respiratory diseases, especially among pediatric and geriatric populations. Transmission and pathogenesis. HMPV spreads predominantly via respiratory droplets, expelled during coughing, sneezing, or talking by infected individuals. Indirect transmission occurs through contact with contaminated surfaces, fomites, followed by self-inoculation of the mucous membranes in the eyes, nose, or mouth. Crowded settings such as schools, childcare facilities, nursing homes, and public transportation serve as critical hubs for viral dissemination. Clinical manifestations. The clinical presentation of HMPV varies, including rhinorrhea, persistent cough, fever, shortness of breath, sore throat, and wheezing. Severity depends on host factors, with complications like bronchiolitis and pneumonia more common in high-risk groups. Neonates and infants under 2 years old are particularly vulnerable due to immature immune responses. Elderly individuals, especially those over 65 years, face heightened risk due to immunosenescence and age-related physiological decline. Chronic conditions such as asthma, chronic obstructive pulmonary disease, COPD, and cardiovascular diseases exacerbate the severity of HMPV infections. Immunocompromised individuals, including cancer patients undergoing chemotherapy or organ transplant recipients on immunosuppressive therapies, are at increased risk for severe outcomes. Diagnosis. The diagnosis of HMPV relies on molecular techniques, with polymerase chain reaction, PCR, being the gold standard for detecting viral RNA. Additional diagnostic tools include antigen detection assays and serological tests to confirm acute or past infections. Management and treatment. Currently, no specific antiviral agents are approved for HMPV, and treatment remains supportive. Symptom management includes maintaining hydration, administering antipyretics for fever, and providing analgesics for pain relief. Severe cases, particularly those involving respiratory distress, may require supplemental oxygen or mechanical ventilation. Prevention strategies. Preventive measures focus on reducing transmission through rigorous hand hygiene practices, including washing hands with soap and water for at least 20 seconds. Adherence to respiratory etiquette, such as covering the mouth and nose while coughing or sneezing, is essential. Avoiding close contact with symptomatic individuals and self-isolating when ill are critical to breaking the chain of infection. Regular disinfection of high-touch surfaces, such as doorknobs, mobile devices, and communal areas, helps minimize the spread of the virus. Limiting exposure to crowded or enclosed environments during outbreaks is especially recommended for high-risk groups. Research and future directions. Current research focuses on developing vaccines and antiviral treatments to address the unmet clinical need for HMPV. Studies aim to elucidate the molecular mechanisms of viral pathogenesis and host immune interactions, informing vaccine design. Public health initiatives emphasize increasing awareness of HMPV to facilitate early detection and management. Public health implications. Caregivers and parents should vigilantly monitor children for early signs of respiratory compromise, particularly during winter months when HMPV is most prevalent. Healthcare providers highlight the importance of respiratory hygiene and proactive prevention strategies to mitigate the broader impact of respiratory viruses. Conclusion. A comprehensive understanding of HMPV's epidemiology and clinical impact is critical for developing targeted interventions and protective measures for vulnerable populations. By combining preventive strategies, public awareness, and innovative research, the global burden of HMPV can be significantly reduced. Collaborative efforts across healthcare, research, and public health sectors will play a pivotal role in mitigating the effects of this respiratory pathogen on global health systems.